Hi, I'm Dr. Walter Lin with the Buncke Clinic in San Francisco, and today I'll be discussing the essential home hand exercises that you should be doing while waiting for your first hand therapy appointment. These exercises will help speed up your recovery and optimize your results after an injury or hand surgery, and they'll help prevent your hand and fingers from getting stiff and frozen. These only apply if you've been instructed by your surgeon to start early active motion, and these are not a substitute for hand therapy. For optimal results, you definitely should still go see your hand therapist as prescribed. The essential hand exercises can be broken down into 7 basic motions. The first is to fully straighten out your fingers and make them as flat as a table. You might have to use your other hand to help pull your fingers fully straight. The second is a cat claw or hook, where you're trying to bend your second and third row of knuckles at each finger. And again, you may need to use your other hand to push and hold your fingers until they can reach this hook shape. The third is a tabletop or upside down L, where you're trying to bend your first knuckles while keeping your second and third knuckles straight. The fourth exercise is to combine the last 2 exercises and make a full fist. Here you're trying to reach your fingertips all the way down to the line in your palm. Ideally, try to make a sharp corner at your first and second and preferably third knuckles. The fifth exercise is to spread your fingers apart and back together again. The sixth exercise is for your thumb. Try to do a full thumbs up and then reach your thumb all the way across your hand and try to scratch the base of your pinky finger using the tip of your thumb. The seventh exercise includes your wrist. Move your wrist back and forth while relaxing your fingers and curling your fingers. Your fingers should naturally curl on their own as you move your wrist back and forth. It may be helpful to do these exercises with your hand above your heart to help prevent your hand from getting too swollen. People always ask how often they should be doing these exercises. I recommend to do these exercises at least once per hour, and your results will be better if you can do these more often, for example, during every commercial break while watching TV. I also think it's important to remember to press and hold each pose for at least several minutes at a time. If your fingers are particularly stiff, you may end up needing to hold them for 20 to 30 minutes at a time in order to get an amount of useful stretch. Keep in mind, no pain, no gain. If your fingers don't hurt while you're performing these exercises, it means you're not stretching your fingers. There should be some amount of pain, but it shouldn't be excruciating. If you're able to do these 7 basic exercises, straightening your fingers, the cat claw or hook, the tabletop, the full combined fist, spreading your fingers apart and back together, a full thumbs up and scratching the base of your pinky finger, and moving your wrist back and forth while curling and relaxing your fingers, then you'll have a quicker recovery and better overall results after your injury or surgery. Thanks for watching, and as always, contact your surgeon if you have any questions about your rehabilitation program and if these exercises are right for you to perform. For more information, check out our website at thebunkekeclinic.org. Thanks.